So I'd like to do an update on my knee. Today would be 1 month and 1 day since my surgery. I think I've made a lot of progress this past month. Everything is starting to feel a lot better. Physical therapy is still tough, but better. I'm going twice a week, Monday and Wednesday. So my last physical therapy session was Wednesday this week. And as a lot of people know, when you have a major surgery like that, especially on your knee, your quad will shut off basically, and the muscles won't fire. So a lot of what PT is getting your leg to start firing again. So my quad's finally starting to fire a little bit more. I'm able to when I lay down, I'm able to pick my leg up. However, there's a quad lag, which means I'm picking my leg up. But if this is my quad and it's straight, it's supposed to be straight when you pick it up. From my knee down, it's a little bit like this. So I'm able to pick it up, but the quad's lagging behind. So I'm not ready for my brace to be bent yet. However, I have not really been in my brace as much. I've been walking around on it more. I think it helps get more blood flow through. I'm also going to talk about the supplementation I've been on, as well as some other things that I'm taking called BPC-157 and TB-500. Those are not steroids. I want to clarify, both of which are peptides. And I want to talk about it because I think that this is good knowledge for people to hear. I think that these are two good products that if someone's having a surgery, they should look into. I'm not saying use it. I'm saying do your own research and come to your own conclusion whether or not you want to use them. I use them. I'm going to go over how I do it and how I think that they've been affecting me. I'm actually going to show you how I do it today in the video. But some things I'd like to talk about for my knee. So I was able to bend my knee to 98 degrees on Wednesday. So that beat my previous, I believe it was 89 degrees I got to. So I got bent to 97 degrees, and and for like straightening my leg as much as I can, I got to -5, which that needs to be 0. So good progress. Also yesterday, as I was talking about being able to raise my leg finally and lift my leg up, I also can do that seated, which I was not able to do last week. So I can sit down with my back against the wall and lift my leg up. That being said, it's very difficult and there still is a big quad lag, but still big progress from not being able to do it at all. Also, when I did that, and this was at physical therapy, I had a lot of popping and cracking going on, probably 3 or 4 times, I think 4 times. And that is scar tissue breaking up. So hopefully more blood flow is getting into my knee. And hopefully that helps. It was really sore Wednesday into Thursday and pretty sore Thursday. It feels a lot better now, however. So that's where I'm at with physical therapy. I'm going to post a picture now of my incision, as it looks a lot better. I just can't get the whatever they put the butterfly stitches on when they took my other stitches out. Whatever they put to make it stick, I can't get that off my knee. It's really hard to come off. But you'll be able to see the incision very well and see what that looks like, and it's healing really well. So after the picture shows, I'm going to move into the BPC-157 and the TB-500 and how I do it. And then I will show my supplementation. Okay, so this is how I actually have to mix the TB-500. I use a whole bottle of it on Mondays and Fridays, and again, it's 2 milligrams a bottle. You have to reconstitute it with sodium chloride or saline. So I'm actually going to show you that process really quickly. So you take the bottle. Always got to be cleanly. And that's so alcohol wipe that off. Wipe off the sodium chloride. And then I just use this. This is, I think, a 25 gauge. I just use this to bring the solution into the TB-500. So as you can see, they come in powder. Same with BPC. You also have to reconstitute the powder for BPC. The BPC lasts about, one bottle of it lasts about 10 days, as you have to do that one about every day.
So, get this done real quick.
Okay, now that you have that done, you stick it in the TB-500. And you aim for, you go on the sides so you don't mess the powder up. And you put it in slowly. You let it hit on the side so that you can not shoot the solution straight into the powder. So after you do that, you mix it for a little bit. So a good way to do it is just do it rolling your hands like this. It will allow to mix all the powder up.
Wipe this off again
with a new alcohol wipe that I have right here. So wipe that off, and then I'm gonna wipe my knee off. Again, let me see if I can. So I do right here. So I try to straighten my leg out some. Just makes it a little bit easier. And I take the 1 cc here. They're really small needles that I use. They're just insulin needles I picked up at Amazon. So then you put it in the TB-500. Okay, so you draw a whole bottle of the TB-500. Make sure there's no air bubbles. And the way I do it is since my skin's really tight, I have to pull it out this way. Then you shoot it like a dart. And then pull it out. And I bleed a little bit, but I'm also still on, blood thinners. Well, not really blood thinners, aspirin, I suppose.
And then while we're here,
I will also do the BPC, and you follow the same process with that, except you only do 1/10. So I have an even smaller needle for that one. The one that I just used for the TB-500 was 30 gauge. This one is the TB-500 is a 29 gauge. This one is a 30 gauge, so it's even smaller, as you only need to do 1/10 of a cc compared to a whole entire thing of TB-500. So same thing, stick it, make sure it's wiped off, which I did wipe it already. Stick the needle in. Then you have so now you have your 1/10, I don't know if you can see that. The plunger's right at 110. Then the same thing, and again, I wipe my leg off with alcohol wipe, so this is clean. And I go about right there. Same thing, go shoot like a dart and push that in. The BPC, at least to me, It burns a little bit going in, but not much. That one doesn't make me bleed. The other one made me bleed a little bit more just because I had to push it in so far. But again, so that's how I do my BPC and my TB-500. Again, I do 1/10 cc of BPC-157 every day. And I think I do that for 2 months. I might be wrong on that. And then the TB-500, I do I do that twice a week, Monday and Friday. And that is 2 milligrams. So that's about 1 and 1/10 cc sodium chloride mixed in with the 2 milligram powder of TB-500, and then so you reconstitute it, mix it up, and then you do that in your knee as close to the site as you can. Hope this helps people. If you guys have any questions, let me know. And again, these aren't steroids; they're peptides. They're naturally produced in your own body. You can, I recommend you do your own research. Don't take my word on anything. Do your own research and let me know what you guys think. So for BPC-157, that is this vial. If you can see, let me see if I can get it to show the BPC. Well, the camera's backwards, but this is the BPC, and you dose it in 1/10 of a cc, which means you just do 1/10 of a milliliter. Cc equals a milliliter, and you it's a subcutaneous injection, which I probably said that wrong. And you do it right above I do it right above my knee. My thought process on that is gravity will pull it down. And what BPC does, and I'll post a link in the description to some news sources, or not news sources, but peer-reviewed articles that I've done research on, as well as other resources. But basically, it accelerates healing. It helps tendon heal, tendons and ligaments heal, and it also has a lot of other benefits, which I can list in the description. And the TB-500 is the same thing, except you do, I do 4 milligrams a week, so 2 milligrams on Monday, 2 milligrams on Friday. It's also a subcutaneous injection, done right above the knee, as close to my ACL as I can. But if it's within 4 inches, it should work fine. And what that does basically is I'll also post a link in the description to some research I've done, but it will bring new blood vessels in and allow for accelerated healing as well. So that's how that's done. And I'll take a picture and also put in how I do it in my knee if anyone's interested. And then after that, I'll talk about my supplementation real quick. So here's some of the supplementation that I've been taking. I'll start off with the Camu Powder. The reason I take this is because it has 10 times vitamin C than one orange, and one orange is I believe your daily dose of vitamin C. So I like to take this and keep my antioxidants very high. So there's that. I take 1 teaspoon of that. Then I take First Form's multivitamin. They're microfactor. I like these a lot. They have a lot of good things in them. So they have an antioxidant, a multivitamin, probiotic, CoQ10, EFA, and a fruits and veggie pill. So I take 1 of these a day, which again, very beneficial. I take just a simple vitamin B12 that I got off Amazon. I take I take a vitamin D. So it calls for 1 capsule, but I take 2. I'm trying to boost my vitamin D. So I believe that's 10,000 IU is what I take daily. I take First Form's joint mobility supplement. help, just try to help build up the joint and tendon. I supplement that with a BPC-157 and TB-500, and again, I think it helps a lot. My fish oil, so I take a fish oil from First Form Full Mega. Again, just helps with inflammation. I make sure I take this daily. I take 4 a day, not just 2. I take a ZMA. This just helps. I take this at night, just fill in some micronutrient gaps. So I do that, and I also take Boron. So Boron has a bunch of benefits, but I like taking it. I just got one of these off Amazon. Just put a little bit in with orange juice when I mix it with my Camu powder. So if anybody has any questions, please let me know.